Hi, my name is Michael Caduce, EMS educator at the EMS Learning Resources Center at the University of Iowa. Today, we will be discussing the skill of medical assessment. Before beginning the assessment, I will apply the proper body substance isolation, which includes gloves and eye protection. I will also make sure the scene is safe for my crew and my patient. Then I will determine the number of patients and the nature of illness. If there is more than one patient or the patient's condition warrants, I will call for additional resources. If there is concern for trauma, I will take cervical spine precautions. I can now begin my primary survey and state my general impression of the patient. Next, I will determine the level of responsiveness by introducing myself. If the patient is not alert or responsive to voice, I need to check for a response to painful stimuli by a sternal rub or trapezius pinch. Then I determine the patient's chief complaint, either by asking or moving into my assessment. Next, I will assess the patient for any life threats. If the patient speaks without difficulty, they have an open and patent airway. If the patient cannot speak or is unresponsive, I can assess the airway by looking, listening, and feeling for breathing. Then I ensure adequate breathing by assessing volume, rate, and breathing effort. If needed, I will supply proper oxygen therapy at this time. The next step in the primary assessment is to assess the patient's circulation. In an unresponsive patient, I will assess the carotid artery. If the patient is responsive, I will assess the radial artery. I am assessing for pulse rate, strength, quality, and rhythm. I will also assess the skin parameters, looking for color, moisture, and temperature, and ensuring to control any major bleeding. Since I have completed the primary assessment, I will make my transport decision. Hi, my name is Michael with the EMSLRC. What's your name?
My name's Logan.
Hi Logan, what's going on today? What caused you to call 911?
My abdomen's been hurting a lot.
The patient appears to be alert. He made eye contact with me when I entered the room. His chief complaint appears to be abdominal pain. His airway is open and patent as he's answering all my questions. He doesn't appear to be short of breath, though I'm going to ask him, do you feel like you're short of breath or having any difficulty breathing?
No, I'm fine.
Next, I'll assess for a pulse. I'm going to assess your pulse. His pulse appears regular. His skin parameters are pink, warm, and dry. My primary assessment is complete with no life-threatening injuries. History taking is an important step in the assessment of my medical patient. To do so, I will begin assessing for pertinent findings pertaining to the chief complaint. I will need an understanding of the patient's past medical history. This information includes any obvious signs of illness or injury and any reported symptoms from the patient, allergies the patient may have, any current medications to include prescription medications, over-the-counter medications, herbal remedies, or illicit drugs. Previous medical history, which can include medical conditions the patient is currently under the advisement of a doctor for, conditions the patient takes medications, or conditions the patient has previously seen a doctor for, the last oral intake, and the events leading up to this present illness. I will ask the patient about the onsetting activity, if anything provokes the condition to be worse, or anything makes the condition better, the quality of the pain or feeling, if the pain radiates to any other location, the severity of the problem on a scale from 0 to 10, with 0 being no pain and 10 being the worst amount of pain they can imagine, and the time when the problem started. I will then ask the patient if there is anything else they can clarify about their presenting condition. Besides the abdominal pain, is anything else going on today?
No, that's it.
Okay. Can you point to your abdominal pain?
Like right here.
Okay. Do you have any allergies to any medications?
Just seasonal stuff.
Okay.
Taking Benadryl for it.
Okay. Any other medications that you're taking on a daily basis?
No.
Okay. Are there any medical conditions that you follow up with a physician for on a regular basis?
Not at all.
Okay. What were you doing when you noticed this abdominal pain?
I was running on the treadmill.
Okay. About how long ago were you running on the treadmill?
About an hour.
Okay. And what was the last thing you ate today?
I just had breakfast.
Okay. About 2 hours ago?
Yeah, we had waffles.
Okay, excellent. You were running on the treadmill when it started. Is there anything that you found that makes it better or worse?
Sitting down, I felt it, but then after a while, it like faded away.
Okay. Did you do anything that made it fade away? Put ice on it? Anything like that?
No, I just sat down and I was hoping it would go away.
Okay. If you were asked to describe it as a dull pain, a sharp pain, a stabbing, a shooting, a constant pain, how would you describe it?
It's kind of dull at first,
Okay.
and then it goes away, but it's definitely noticeable.
Okay, understand. It's a dull pain, kind of comes and goes.
Yeah.
Okay. If 0's no pain and 10's the worst pain you can imagine, what are you giving it right now?
Between a 5 and a 6.
Okay, okay. And you said it started about 2 hours ago when you were running on the treadmill?
Uh-huh.
Okay. I've completed my sample history. I've obtained a medical history on this patient. I've also completed my OPQRST assessment. Next, I would determine my level of transport. The patient appears stable, so we're going to take a transport to the hospital without using lights and sirens. Moving into my more focused assessment, I'm going to palpate my patient's abdomen, starting where it doesn't hurt and moving to where it does hurt. I'm assessing for rebound tenderness and guarding on my patient. Logan, I'm going to palpate your abdomen and just see if I feel anything, okay?
Okay.
I want you to tell me if it hurts, okay?
Ah.
The patient reports some pain in their upper right quadrant. I don't feel any rebounding. The patient does have some guarding when I palpate that area. I want to continue on in my secondary assessment, including things like a mental status assessment and maybe a little bit more in-depth breathing assessment. Logan, can you tell me what day of the week it is today?
It's Thursday.
And who's the president?
Obama.
And what month are we in?
August.
Okay. So he's alert to time, place, self, and event. I'm going to listen to your lung sounds. Do you have a history of having any lung problems?
Mm-mm.
I'm going to have you take some nice big deep breaths for me, okay, Logan?
Okay.
Good. And another one? Right here in your armpit. And one more big deep breath. And you can breathe normal, okay? The patient's lung sounds are clear and equal. He does not appear to be in any distress breathing. He also has normal heart sounds. After completing my focused assessment, I would move in to obtain a set of vital signs. That would include pulse rate, blood pressure, and respiratory rate. Finally, I will complete a radio report of the patient's condition to the closest appropriate facility. University of Iowa, this is Medic 1. We're en route with a 20-year-old male who's reporting abdominal pain. The patient has had the pain for the last 2 hours. It started while he was running on the treadmill, and he rates it a 5 to 6 out of 10. The patient's vital signs include a blood pressure of 126/82, a respiratory rate of 16, and a heart rate of 87. We are 10 minutes out. Any questions or orders? Treatment of a medical patient is a necessary skill for the EMS provider.